Hello coders, welcome to Super Coder 21 where you will learn medical coding using English, Telugu and Hindi languages. Today we are going to learn CPC exam tips part 1 related to nervous system. So this session will be very useful for the people who wants to write CPC exam as well as people who wants to learn surgery coding or the people who wants to sharp their surgery coding skills. If you are visiting for the first time, please click on subscribe button to receive future updates. After watching this session, if you like this session, please click on like button so that YouTube will send this video to other people who are in need of these CPC exam tips. And also, if you are looking for medical coding jobs in UAE, India or USA, please send your mobile number to 707-526-3939 so that we can add you in our WhatsApp group. And also please note that we are having two YouTube channels. One is for English, usually it named as Fast Coder 21. For Telugu, we are having Super Coder 21. This channel contains both English as well as Telugu videos. And also if anyone looking for same day surgery coding training, please send WhatsApp message to 707-526-3939. So today we are going to learn nervous system as well as endocrine system practice questions for your CPC exam. Okay. So here these all are MCQs, means multiple choice questions. So try to find the answer. Then you can mention in the chat box or you can speak out. So first we will practice first question. What does contralateral mean? So what is contralateral? Anyone know or not? Yeah. Here we are having four options. Affecting or originating in the opposite side, pertaining to the same side of the body, lateral contractions, contractions occurring on opposite sides of the body. Okay. So what is your opinion here? What is the correct answer? So basically in CPT coding or in ICD coding, so we are having few codes based on the laterality. Okay. So here what does contralateral mean? Means affecting or originating in the opposite side. Okay, so whenever you see this contralateral, you need to remind yourself we are having one word related to ipsilateral. So ipsilateral means same side, contralateral means opposite side. Mostly we will see this ipsilateral, contralateral on the thyroid surgeries as well as interventional radiology procedures. Okay, so now what is a contralateral, guys? What is the answer now? A, B, C or D? So here your answer is A, affecting or originating in the opposite side. Okay. For example, here you may see the question like, what does ipsilateral mean? So what is the correct answer then? Anyone? Yeah, B. Ipsilateral means same side. Okay. Contralateral means opposite side. Just try to remember that. Most of the time you will see this concept in the thyroid surgeries as well as interventional radiology CPT procedures. Okay. So now, so using this question, you got two question and answer. First one is contralateral means opposite side. Ipsilateral means same side of the body. Okay. Next, what is parathyroidectomy? So basically, in the endocrine system, we are having few glands like thyroid gland, which is the major gland, and few smaller gland related to thyroid. So this is parathyroidectomy. So here physician is removing the parathyroid gland. Okay. So ectomy means removal. So physician is removing the parathyroid gland. Okay. So as soon as you see the parathyroidectomy, you need to remember that first of all you need to know the anatomy of the parathyroid gland. So these parathyroid glands are present back side of the thyroid gland. So now tell me which is the correct answer. Back side of the thyroid gland. These parathyroid glands are, yeah, perfect. So back side of the thyroid gland means posterior surface of the thyroid. So removal of glands on the posterior surface of the thyroid, we will call it as parathyroidectomy. Just you need to understand the anatomy here. So where does these parathyroid glands located related to thyroid gland? Okay, so if you know the anatomy, you can code it very easily. Okay. Next, what is laminotomy? So tell anyone answer. So no need to worry about whether it is correct or wrong. So you need to participate so that you will get the confidence.
Think B.
Anyone? So we have discussed already, correct? What is carpectomy? Take 2 minutes and tell the answer. So what are the answer? Any option? Yeah, perfect. Approach. So this series 615802 to 61598 are related to approach. So here you need to code it as approach. So your answer is D. Okay. So next, fifth one. What are the four lobes of the brain? Take 2 minutes and answer. So, so here, what are the four lobes of the brain? So the four lobes of the brain are frontal, parietal, temporal, and occipital lobes. Okay. So next one. What disease is characterized by enlarged skeletal parts? What do you call? So here your correct answer is acromegaly. Okay. So basically, megaly means enlargement. So enlargement of the joints, you will call it as acromegaly. Okay. Next.
David, how to
Next. What is the term for uncontrolled muscle movements? Check the Google. So if you are familiar with your ICD-10 CM as well as CPT books, 80% of exam you will be succeed. Why means they will provide each and every question using the CPT and ICD book only. But before going to the exam, you need to know the location of each and every word. You need to familiar with your ICD-10 CM book. Not all, most of the definitions you will they will available in the ICD-10 CM book. Seventh one is D, dyskinesia. So what is the term for uncontrolled muscle movements? The answer is dyskinesia. Okay. Next, what is the term for paralysis? Is affecting one side of the body. The answer for this one is what is the term for paralysis affecting one side of the body is hemiplegia. So basically here you need to divide the word. Hemi means half, plegia means paralysis. Okay, so one side of paralysis is called as hemiplegia. Okay, so ninth one, looking in the CPT manual, the nervous system is divided into what subheadings? See your CPT book and answer. CPT book and you need to check what are the subsections used in the nervous system chapter. So here our answer is B, skull, meninges and brain. Then we are having spine and spinal cord. Next extracranial nerves. Next peripheral nerves and autonomic nervous system. Okay, so as all of us know, nervous system starts from skull, correct? So that's why they have started subsections from skull, meninges and brain. Next, spine and spinal cord. Next, extracranial nerves, peripheral nerves and autonomic nervous system. So here for ninth one, B is the correct answer, not A. Okay. So tenth one, what is a dime-sized opening in the skull to access the brain called? Take 2 minutes and answer. So the correct answer for tenth one, what is a dime-sized opening in the skull to access the brain is called as burr hole. Okay, so this is the starting point whenever patient wants to perform uh, procedures on the brain. You will call it as burr hole. Okay, so next, 11th one, a patient with chronic lumbago is seen by the physician to have an epidural injection at the sacral level. What CPT code is required for this procedure? Use your CPT book and check the code descriptions. So here our answer is 62311. Okay, so basically whenever you code epidural injections, we are having injection using the needle as well as the infusion. Okay, so injection is the single shot. Only one time patient will administer the medications. So infusion is longer duration. For example, if the patient wants to give the medication step by step increments, so that time he will use the infusion. But based on this scenario, patient did not mention whether it is injection or infusion. Why means in CPT we are having separate codes. For infusion separate codes and injection separate codes. So here based on this scenario, you need to code 62311. Okay, so here our answer is 62311. For this code, you need to use 62322. Okay, see here, you need to use 62322. So
Okay.
62311 is deleted. So note down, you need to use 62322. So what is 62322? We'll check. So 62322 is injection of diagnostic or therapeutic substance, not including neurolytic substances, including needle or catheter placement, intralaminar, epidural or subarachnoid, lumbar or sacral without imaging guidance. Okay, so here whenever you code injections, what are our keywords? How many levels physician has performed the injection. Next keyword is whether physician used injection or infusion. Okay. Next you need to check approach. What is the approach? So based on here, this is the epidural approach, and spinal level is only single level. Okay. So here you need to use 62322 instead of 62311. Just note it down, 62322. Correct answer. Okay. Next, 12th one. What is the ICD-10 CM code for cavernous hemangioma in intracranial structures? So take 2 minutes and answer it. Uh, Correct. Here your answer is what is the ICD-10 CM code for cavernous hemangioma in intracranial structures? You need to use D18.02. Okay. So now practice this one. 13. The physician removes the thymus gland in a 27-year-old female with myasthenia gravis. Okay. So using a transcervical approach. What is transcervical approach? So transcervical means through the neck. Okay. So the blood supply to the thymus is divided and the thymus is dissected free from the pericardium and the thymus is removed. What CPT code is reported for this procedure? So use your CPT book and check fast. Take 2 minutes. Which one? Yeah, 60520 is the correct answer. So whenever you want to choose one single code, just check three codes above the your selected code and three codes below the your selected codes. For example, if you want to choose 60520, check before 60520 three codes and check after 60520 three codes, so that you will get good idea and you will get to know what are the variants of these procedures. Okay, so basically these thymectomy procedures are based on the approach. So here our approach is trans-cervical. So we need to code 60520. Okay, correct answer. So next one, 14th one. What ICD-10-CM code is used for intractable grand mal seizures without status epilepticus? Using epilepsy generalized as specified. So here your answer is G40.419. So we will see last question for this weekend. So 15th one. A patient is receiving pain management treatment for chronic cervical pain caused by a motor vehicle accident. What ICD-10-CM codes and sequencing is reported? So here you need to use your ICD-10-CM guidelines basically. Okay, so tell me, check your guidelines and tell me. Take 3 minutes. In this scenario, exclusively you need to understand the ICD-10-CM guidelines. First, you need to understand what is the purpose of this encounter. Okay. So in this scenario, your answer is A. So basically here our ICD-10-CM guideline states that if the patient came in for pain management, okay, so you need to code G code, G89.21. Then you need to code M54.2 for site specific pain. So here documentation contains chronic cervical pain, correct? Okay, so M54.2 is for cervicalgia and G89.21 for chronic pain as patient came in for pain management. Okay, so like that in this scenario you need to follow your ICD-10-CM guidelines. Just
So
subscribe to our.
David, I
So
have
we are
one
having
question.
two YouTube channels. So
Okay.
Fastcoder 21 is English channel. Okay, so recently we have started one channel for Telugu as well as CPC practice sessions, which is Supercoder 21. So you can subscribe to our old channel also.